Well, let's give people the knowledge. Somebody that is willing to make these dietary changes. We know cutting back on the carbs is a piece of this. How much do we need to do that? Let's take it right from the beginning. Somebody's overweight right now. They've been eating a standard diet. They want to start making shifts. Do you recommend going cold turkey to a certain carb threshold? Or do you recommend taking things slowly? What would you say?
This really needs to be tailored, to the individual. And I find that there are two big factors that go into this. Number one is how metabolically broken are you to start with? If you already have type 2 diabetes, you've been insulin resistant for many years, perhaps you have heart disease or early signs of heart disease, you are going to need a significant intervention. And, going very low carb right from the beginning is probably, what you need. If, you're not there yet, if you have, maybe your insulin level is a little bit high, maybe one or two of these metabolic health measures are not in a healthy range, you might be able to, ease into it, just cut your carbohydrates some. But that's going to be one factor. And the other factor really comes down to personality. We all know that some people are let's just jump right in, do it 100% and get it done. And other people need that sort of ease in process. What's interesting about the carbohydrates, though, and especially we're talking about the processed carbohydrates, is it really does seem to be easier the more you eliminate them. They are addictive. Sugar, we know, is addictive. Processed carbohydrates are addictive. And so, the more you're eating them, the more your body wants them. And that has to do, there are probably many different aspects of this. There's a psychologic addiction, the physical sort of biochemical addiction in the brain. There are some microbiome effects that, feed some of this. But whatever it's coming from, we have to recognize that. And so a lot of people struggle when they just try and moderate their carbohydrate intake, and instead they need to eliminate it. And, again, I liken it to, alcohol. And people who have addictive issues around alcohol, the message is not moderate your alcohol intake. The message is eliminate alcohol. And really, we can do the same thing with carbohydrates. This is another important concept that people need to understand and that may not be clear because of our messaging. Carbohydrates are not essential to the human diet. We can survive without carbohydrates. We can literally eat 0 carbohydrates and survive just fine as human beings. So it is possible, it is an option to completely eliminate carbohydrates in the same way we talk about completely eliminating alcohol. Today, in our modern food environment, that's viewed as extreme. Many nutritionists will tell you that it's an eating disorder if you eliminate, carbohydrates, if you would eliminate one macro from your diet. But that's not historically true. On an evolutionary standpoint, we have plenty of evidence that we ate very little to 0 carbohydrates and survived just fine. In fact, we thrived. That's how we evolved as human beings, eating fat and protein, not eating carbohydrates. So I want people to understand that complete elimination of carbohydrates is an option. It is safe to do. And despite what you may hear from, what are really ill-informed, doctors, nutritionists, health influencers of all sorts that will tell you that carbohydrates are essential, our body needs sugar. What they're confusing is, yes, our body needs sugar. It needs glucose in the bloodstream. You can't have a glucose level of 0, but our body can make all of the glucose it needs. We don't need to eat it for survival.
And for somebody that's thinking to themselves, this seems so radical, I could never cut out carbohydrates. A lot of what we're doing in the modern world that's taking us to this level of being overweight and obese is very radical. And sometimes you need to do radical things to correct for radical previous behavior. So, and this doesn't necessarily have to be for life. If you're 350 pounds and you need to come back to baseline, whatever that is for you, maybe you need to do something radical for a period of time and get your health back, get your metabolic health back. And you talk about in the book how you're somebody that doesn't want to be known for never having a bagel or ice cream. You've taken your metabolic health back and now you have room for those things if you choose.
Yeah, that's exactly it. And that's an important distinction. If I choose, I am intentional about what I eat. And yes, sometimes I'm going to make that choice for whatever reason, knowing that my body can now handle it because I am metabolically healthy. But when I was not metabolically healthy, when I was morbidly obese, and when I was pre-diabetic, my body couldn't handle those things. And so I was very severe. I severely reduced my intake of them. And today I eat very little of them because, again, I know they're not essential to me. They don't provide any real benefit to me. And if I eat them in excess, it's going to harm me. It's going to get me back to where I was. So why would I choose to consume something like that? And when you think about it in that context, that is the mindset change that helps people. And again, if you do it intentionally, if you're thinking about what you're eating, that's going to lead you to success. The problem that I see that gets us into this is that most of us don't actually think about what we eat. There's stuff all around us that we've been told is food, and we just eat it. And that's great if you're the food industry. They're more than happy to keep pushing this food on you that's very profitable, keeps you addictive, keeps you coming back for more, but it's not serving your health. And if your health is important to you, you need to start paying attention to the foods that you're eating. And the other good news about this is that, we don't have to, we've been brainwashed again into thinking that the only way to reverse this problem is with dietary changes that are very hard to maintain. Severely reducing your caloric intake, cutting all the fat out of your diet when fat is in fact essential to life. And so our bodies actually fight back against these things because, if you're trying to basically starve your body, it's going to fight back. If you're cutting out essential things like fat, it's going to fight back. The body doesn't actually fight back against cutting out carbohydrates because it's not essential. You have to sort of detoxify from them. As I said, there is an addictive component and you have to get through that. But once you do that, the body pretty much says, yeah, we're functioning better like this. We don't need this stuff. And it becomes easy to maintain over a lifetime. It becomes a sustainable way of living. And that's, what we ultimately need.
To make sure we're crystal clear here while we talk about carbs, we're using different words such as sugar, processed carbs. Are those all under the same umbrella for you? Because we could be talking about within that umbrella processed white sugar or fruit on the other end of the spectrum. So when somebody decides to make this shift, is there a difference there between the two?
Well, ultimately there really isn't a difference in the sense of it all gets turned into the same sugar when our body metabolizes it. The difference is in the degree of harm that comes from it because of the more processed it is. Basically, what that means is that it can get into our bloodstreams quicker, and it oftentimes is then also combined with other things that are going to be harmful. We haven't really even started talking about, the vegetable and the seed oils, the processed oils, processed fats that have been introduced into our diet and play a role in all of this. So ultimately, all carbohydrates are the same. If you are metabolically broken, if your metabolic health is not good, if you are insulin resistant, you cannot handle carbohydrate no matter what form it is. If it's a fruit, or if it's a box of Oreos, it's all sugar. And you need to be careful about how much sugar and carbohydrate you're taking in. Now, if you're metabolically healthy and you want to incorporate some carbohydrate into your diet, again, now we have a spectrum of how damaging these things are going to be. And yes, of course, I would prefer you have the fruit, the unprocessed carbohydrates, rather than, the heavily processed carbohydrates. There is going to be a difference in how your body responds to that, and, how likely to damage your metabolism those things are. So, you'll oftentimes hear people say, well, no one becomes fat or no one becomes insulin resistant from eating fruit. And yeah, if fruit is the only carbohydrate in your diet, you're right. You're probably not going to get to that point of insulin resistance or being obese. But once you are obese, once you are insulin resistant, your body, is just as impaired in its ability to handle the fruit as it is the bread and the pasta and the Oreo cookies.
And just to make sure people are following, tying this back to what we talked about before, when we ingest those carbs, they become sugar in our system, raising our blood sugar, and then the insulin's going to spike to take care of that blood sugar and bring it back down. If we abuse that over time and continue to spike our blood sugar, we're going to make more and more insulin trying to get rid of the sugar and put it into the cells. And over time, we're going to have problems with the blood sugar and become insulin resistant.
Exactly. Yeah, that's a good way of summarizing it. And, and again, this is not straightforward stuff. There's a lot that goes into this. And this is why I recommend finding someone to guide you through this process, a good practitioner that can help you with this, whether it's a doctor or a nutritionist or some other type of practitioner. But they have to understand insulin resistance. They have to understand metabolic health and help you translate that into, how you live your life day to day.
One thing you're really careful to do in your book is not be really prescriptive when it comes to diet. So I just want to make sure we're practical, though, with people here when they're thinking about carbs. Do you have a certain number that you like to work with when somebody jumps in, like keeping the carbs below this many grams a day? And if you do, is that net or total?
Yeah, so I don't really accept or believe the concept of net versus total carbs. Again, I think that's a food industry manipulation to try and get some of this stuff and say that, oh, well, it's okay because it's this type of carb and not this type of carb. So I look at total carbs. And for someone who is not in optimal metabolic health, my recommendation is usually going to be under 50 grams of carbs a day. And again, that's with the understanding that you can certainly go a lot lower than that. And the lower you go, probably the quicker you're going to see a response, the better you're going to see a response. And some people, respond exceptionally well to very low carbohydrate diets like a carnivore diet. And again, there are also other things that go into this whole equation. Metabolic health, insulin resistance, very important concept. But we also have to keep in mind things like autoimmune diseases that can be triggered by certain foods that we eat, gut problems, leaky gut syndrome that people probably have heard about, caused by certain foods that we eat. So, if you have these types of factors that are playing into your overall health picture, you might require something different. As you mentioned, in the book and in my practice, I work with lots of different dietary strategies because there are different dietary strategies that you can implement to meet these goals. But you have to understand the underlying issues that you're dealing with, the underlying physiology, and then apply them appropriately. And as much as I, am not a big fan of medication-based treatment, we can look at something like medications and we can say, okay, if we're trying to treat a certain medical condition, we usually have multiple types of medications that can be applied to that situation. And we pick, which flavor of medicine based on certain factors about that disease. And I view metabolic health and dietary changes as the same way. There is no one right answer for everyone. When I wrote the book, I intentionally didn't write, Dr. Ovadia's diet plan, Dr. Ovadia's 28-day diet plan, like we see out there so much. My focus is on insulin resistance and metabolic health. And whatever dietary strategy works for you to improve insulin resistance and improve metabolic health, I'm going to be in favor of. And for some people, that's a plant-based vegan diet. And for other people, that's a carnivore diet. Two what would seem to be opposite ends of the spectrum, but they both can work. And the reason that they both can work is because you're eliminating processed food, you're eliminating highly processed carbohydrates, and you're getting success. Now, there are other factors that go into why I favor animal protein-based approaches rather than plant-based approaches. But ultimately, if someone says for whatever reason, I want to be plant-based, I'm going to say, great. If you're improving your metabolic health with your plant-based diet, I'm all in favor of it. But if you're not, we have to take a look at some things and figure out what we need to adjust to improve your metabolic health.
Coming back to that term, total versus net carbs, for anybody that hasn't heard of net carbs, what they're doing there is taking total carbs and subtracting the fiber to come up with that number. So you mentioned you're not a fan of that, but I just wanted for completeness for people to understand.
But also understand that it's not just fiber that they substitute, that they subtract out. They'll also substitute out what are called sugar alcohols, which are another type of sugar substitute, basically. So again, this is really driven by the food industry that wants to be able to, proclaim that some of their foods are low carb. It's a marketing ploy, basically, to say it's ketogenic or it's low carb, and because it has lower net carbs, because we subtracted out this other stuff, it doesn't count. And really, again, most of the food that we should be eating, it shouldn't have a label on it. It shouldn't have a nutritional, you shouldn't need the nutritional ingredient list there. And you shouldn't be saying, well, this ingredient counts, this one doesn't count. The vast majority of the food that we eat, it should be basically single ingredients that we have combined, that you look at it, you know what's in it. And you don't need a label to tell you it's, keto or low carb or low fat or whatever it is.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
The first 10 plus years as a heart surgeon, I was increasingly unhealthy. I was morbidly obese, I was pre-diabetic, and I realized that I was destined for my own operation.